Hi, it's Dr. Mache, and welcome to Ask Dr. Mache on Facebook Live. And I'm so excited to be here with you because every Thursday night, every Thursday evening, 9 p.m. Eastern, I'm here doing Facebook Live, answering your questions and addressing issues that would be helpful so that you can live a healthy, happy, and vibrant life, and also so you can figure it out and not have to tough it out. It's been a kind of exciting day today. I was down seeing patients at Beth Israel Hospital, Harvard Medical School, where I see patients, and I gave a talk today to the nursing staff there. They come in and we talked about estrogen and hormone replacement therapy and talked about a whole host of things that are helpful for women in and around menopause. And I want to give a special shout out to Judy, who may be listening this evening. I want to say thank you. She offered me a very nice testimonial of the help I've been able to give her working with her. And so I want to just say thank you for that. I really appreciate it. I want to begin. We're going to talk about hot flashes this evening. And I think to set it off, I'll begin with these two questions that came in. I think they'll be kind of interesting, and some of the alternative treatments for hot flashes, which may be helpful to you. And this is a sort of an interesting one, so let me read this for you. This is from Brenda, and she's saying, I'm on a low-dose bioidentical hormone therapy. So she's on a Vivelle. She says a Vivelle patch, 0.0375, which is one of the, not the lowest. It starts at 0.025 and then 0.0375. And she's also on 100 milligrams of progesterone. She says, I was also put on a low dose of Celexa, 40 milligrams. I'm not sure why she got put on both things, but she was given. Hello, Melody. How are you? From Kalamazoo, Michigan. Welcome here, and thanks for joining Ask Dr. Mache on Facebook Live. Thank you so much, and please share this with your friends. Let them know we're on now, and be sure to follow me so that you can get notifications if we do these at other times. Anyway, I look forward to talking to you more, Melody, in just a moment. Let me finish these couple questions. So she was got a low dose of Celexa, 40 milligrams daily for hot flashes to help with sleep. And she says, I've heard there might be other medications that might be a better choice. What's your opinion on the different SSRIs and what is better for those of us who are on HRT? And then she says, comparing it to Brisdelle, what are the pros and the cons? Now, Brisdelle is a medication that is it is an SSRI, and it's the only one that is approved for hot flashes. And I'm going to explain all that to you, but I'm going to read a second question that comes in because it's related, and we might as well, let's just put this all, and we'll have a discussion about these various treatments. Now, she says, wanted to know the difference between Effexor, Celexa, Brisdelle. I keep asking my doctor and they say it's the same. My last doctor prescribed Celexa for sleeping better and hot flashes. This new doctor wants to prescribe Effexor, but I read in your book, and she's talking about my book, which is the Estrogen Fix, which is a really good clarification of all this stuff and a whole lot more about hormone therapy, the Estrogen Fix. It came out September the 19th, just a short while ago. Very current, very complete, very easy to read. So she says, but I read in your book, Brisdelle is better. So she says, I'm confused. Okay, so let's talk a little bit about a couple of things. First of all, bioidentical hormones is a form of estrogen. It means that the hormone, the estrogen or progesterone that's in it, is identical to what your body makes. Now, if you are on bioidentical estrogen, I'm unclear why you would need to have Celexa with it. It seems that the bioidentical hormones, if you gave them a little bit of time at the correct dose, would probably take care of those hot flashes. So I'm not sure why you're on both. So I can't quite answer that question. I don't think I would add a second thing to a first thing that's very effective for treatment. And so there may be a piece I don't understand or haven't been told about, but I don't see why you'd need both. But let's talk about these different kinds. There are a bunch of SSRIs, what's good about them, what's bad about them, what's out there, etc. Now the ones that were mentioned, and SSRIs are selective serotonin receptor inhibitors, and what happens is it basically is getting more serotonin up in your brain. And that is the ones that are like Brisdelle, which has other names like paroxetine. That's the other name for Brisdelle, paroxetine, or Paxil. And then there's another one called Celexa, and then Celexa. Now these are, and Prozac is another one you may have heard. All these are SSRIs. They're selective serotonin reuptake inhibitors. They've all been used in some extent for hot flashes because a lot of people are depressed, and a lot of people who are depressed, especially around menopause, can increase their hot flashes. A lot of people who have hot flashes end up getting depressed because they can't sleep. It's disruptive. It's embarrassing. It's a mess. So these two things do go together. So when doctors were treating people for depression with SSRIs, they found out that, hey, some people got better with their hot flashes. And over time, lo and behold, they started using these medications for treatment of hot flashes. Now, those are SSRIs. There's a similar related category called SNRIs, or selective norepinephrine reuptake inhibitors. SSRI, SNRI. So these are very similar medications. They're kind of the same thing, but they're not the same thing. And the one there is called Effexor, or venlafaxine. That's the generic name for it. Now, at dosages that are about half the antidepressant dose, these medications, SSRIs and SNRIs, will help about up to half of women get rid of hot flashes, or at least lower that heat so that they feel better. So this is important so that you get some relief from these hot flashes. Now, about Brisdelle. Now, what makes Brisdelle unique among these? All right, well, let me explain that to you. Brisdelle is the only one that's approved by the FDA. It's actually been used to treat hot flashes and has been found to be effective. And so it's a low dose. It's only 7.5 milligrams. It's too low to actually treat depression. But it does help with hot flashes. And Brisdelle has an advantage on the Effexor and the Celexa because those two, in some instances. Hi, Linda. We have Linda here. She says, my doc has me on clonidine for hot flashes. It makes me tired. We'll get to that in a sec. So the Brisdelle does not lower sex drive. Now, this is a big deal because there you are, you got your hot flashes, you don't get in the mood because you've been up all night with the darn hot flashes and you can't sleep and you're tired and you're exhausted. And so you take something for those hot flashes, those pesky things. So now you finally get on the medicine, your hot flashes are gone. Lydia says, thank you. Yes, indeed, we'll be right there. And you take it and you get rid of the hot flashes. And now you want to go and get amorous with your partner, but hey, you got this medication that robs you. Some people get by with it, but between 25 and 75% of people will have a reduction in libido. And then what happens is, some people don't lubricate well, they don't get aroused. Some people get aroused, but they have an orgasm that doesn't feel right to them, and that doesn't work well for them. So now they get messed up on that side. So now you're rested, but you're not interested. Well, that's no good. So the Brisdelle does not affect that part of the libido thing. So that's what's helpful. Now, clonidine is really like an antihypertensive. It's a medicine used for heart and other things. I don't use it too much because of some of the side effects. Tiredness is one of them. And so I would say that clonidine, there are better choices for you, Linda, that you might want to talk with your doctor about. The Brisdelle is one that it has been approved. It is effective. It doesn't affect libido, but you can try hormone, HRT, different kinds of therapy if you're open to taking hormones, or if you're not unable to take them because of, say, you have other conditions. Now, the nice thing about things like the Brisdelle and some Effexor, clonidine, it could be clonidine, or Celexa, which is what I meant to say, is that in women who do have breast cancer, they're totally not estrogens, and so they're good. Now, Pam is saying, what about OTC remedies for symptoms? Okay, so let me just say, this is what my belief about OTC is. In fact, some of them work, but most of them don't work for everyone. And what they do is they kind of turn down the heat a little bit. So, as I say, everything works for some people and nothing works for everyone. So, here's what you can do is you can go on one of these, and some of the most popular ones and some of the ones that work well, there is black cohosh, which is a very common one. It's branded as Remifemin, but black cohosh is a root that is available. I have it growing in my yard, so in the summer when the black cohosh is going, we can put out the flame in the barbecue pit just from the black cohosh. No, just kidding. That's just a joke. But we do have it growing in my backyard. That part is true. And in Germany, it's part of the botanical arsenal of over-the-counter products that are made. Now, interestingly, in Germany, a lot of the OTCs over here are actually in prescription drugstores over there. Now, soy still remains, in my opinion, a reasonable one to consider. The isoflavones in soy, particularly the one called genistein, is very effective. Some people like iCool is another one that can be effective for some people, and there are a number of them. I actually have them listed, and I give them a rating in my book, The Estrogen Fix. So there's a section in there in alternatives, both the hormonal, non-hormonal prescription ones, and the ones that are over-the-counter. But if you're going to try those over-the-counter, I want you to try one at a time. Try one for, say, a couple of months. If they don't make you feel better, get rid of that one and go to the next one. Because if you keep adding them up, it's going to cost you a lot of money, and it is also going to be confusing because you won't know if it took 2 to make it work or 1, and then you just have this bunch of over-the-counter stuff. And some of that stuff gets pretty expensive, particularly some of the online you can pay $60 a month for. It gets pretty expensive over time. So now, is it Rachel? I hope I got that right. It could be Rachel or Rachel. I hope I'm saying it correctly. First of all, I don't know if you've been on before, but I want to welcome you and say thank you for joining me this evening. And Pam, you are welcome. My doctor put me on Combi Patch. What do you think of this, and what HRT do you prescribe for your patients? Combi Patch is one of the transdermal, meaning it goes through the skin. It's a combination patch with an estrogen and a synthetic progestin in it. It's the only one out there that's transdermal, again, meaning through the skin. And it is the only one that's available for that contains both an estrogen and a progestin. It's a synthetic progesterone in it. Combi Patch is a perfectly good choice. It's good in the sense that it's effective. It has good materials in it, good product in it, and it is a combination. Now that's convenient. The only thing I don't like about Combi Patch is that it doesn't start at the lowest dosages available. So I would typically start people on a different patch, but you have to take the progesterone orally as a additional tablet. That's the downside to my approach. But I always have people on the least amount because a little bit can go a long way, and some people won't need the amount that's in the combi patch, which isn't a high dose, it's just a next dose up. So I like to start at the lowest because so many people get really pretty good relief at the lowest dosages, and you don't need as much as you think. The big difference is between none and some. And if you get some, sometimes that's all you need. And then if people need more, I bump them up. Perfectly good medication, combi patch, perfectly appropriate. It's just that for me personally, I like to help people with the lowest amount and see if that's enough for them. And if it is, then I leave it at that, and then they have the least exposure over time. But the combi patch isn't a high dose. It's just not the lowest dose. So I hope that makes sense to you. And I think it's a perfectly good one. If it's working, everything is fine, you're happy with it, well, then just stick with that. It's absolutely a fine one. Some of the patches can be cut in half if you want to alter your dose a little bit. Combi patch is also one that you cannot do that, but that doesn't make it a bad one. It's perfectly fine. Now, for some of you who may be, if you have questions you want to make sure that I cover, you can go to AskDrMache.com, and you can write in a question ahead of time, and then I do cover those. And just like I did tonight, I went to those first. So AskDrMache.com, and I have a place where you just write in your questions, and then I have a chance to I'll print them out as I did for tonight and put them in. Now, hot flashes are, they're not just for people who just start menopause, because when women get to be 60 to 65 years old, 42% of women are still having hot flashes at 60 to 65 years of age. And about 7% or so, 6-7% of those women are having moderate to severe hot flashes. So this can go on for a while. And, we have to remember that about 5 to 10% of women, or about 1 in 10 to 1 in 20 women will go into menopause before age 45. And the symptoms can start up to 10 years before that. That's a long time to be having to deal with hot flashes, when especially there's a whole lot of treatments that are available. Another prescription medication that's out there that's used sometimes for hot flashes is one called gabapentin. And gabapentin is actually an anti-seizure medication. And for some women, that is used as an alternative in women who either cannot or will not take hormone therapy. And I have, if you're interested, I have a whole course online that's about like a 60-minute course. And if you're interested, you can go to hotflashrescuekit.com, hotflashrescuekit.com, and this actually is something that you can get. It's an online course. It's typically available for $40, $39.97, but I make it available to people who come on Facebook Live for under $20. It's $19.95. And you can, it goes through all the treatments of hot flashes. It goes through all the things you can do. It explains what causes them, how to go about it, and the whole thing. So at the end of that time, you'd really be in a position to talk with your healthcare providers about what to do. hotflashrescuekit.com. Now, Judy, how are you? How long can I stay safely on low-dose HRT? There is no answer. It's not an absolute written in stone answer, but the amount of time is extending. So I would say for most people, I talk to them that it's like a 5-year renewable option. If you're well and healthy, then you can stay on probably for 10 years. If you are staying well and healthy beyond that, there's an increasing body of data that if you maybe keep the lowest dose and talk to people about it and individualize it, that people can stay on it till 65. And I have people on it who have been on it for a lot longer than that. I have to say that rather than give an absolute that you can stay on it for quite a while if you're healthy and you don't develop a condition or a symptom that is makes estrogen less of a good idea than it was when you started it. But most people can stay on it for 5 years, definitely, 10 years, probably, 15 years, maybe, and longer, possibly. So I guess that's the answer. But you can stay on it for a good while, and the data is very reassuring for the women who are well and not having a reason that you can't take it. If the dose stays down low, which is one of the reasons I like to keep the dose at the lower end if it works for you, is that is the safest for the longest usage. Melody, hi, how are you? I have fibro, and it seems like it's in consensus in fibro group that hot flashes are worse if you have fibro. Are you talking about fibromyalgia? You're not talking about fibroids. I just want to make sure I'm talking about the right thing. But if it's fibromyalgia, that's a pretty common autoimmune disease. There's a lot of achiness and pain. Yes, fibromyalgia. Okay. Well, when you have fibromyalgia, there's a lot that goes along with that. People don't feel well. They have aches. They have pains. They don't feel so good. And so hot flashes often do go along with that and are worse. Now, you can go on hormone therapy, with fibromyalgia. I have some people on fibromyalgia, and I put them on hormone therapy to get better because estrogen is an anti-inflammatory. And fibromyalgia is an inflammatory process. I really think, though, if you look at your diet carefully and you exercise, I know you don't want to exercise because everything hurts and aches, but if you do exercise, if you clean up your diet, eat whole foods, and if you eliminate the sugars and a lot of the other foods that are inflammatory in nature, processed foods, and so forth, you may find that too is as helpful as some of the medications that you get, and hormone therapy is certainly a reasonable thing to take in the presence of fibromyalgia, assuming you don't have other things that I, of course, wouldn't be able to know about. Michelle says, thank you. I've been on many times before. The combi patch can be cut in half. That's how you're using it. Okay, well, that's good. And I'm glad that you are here this evening, and thank you for joining. So Melody says she does exercise and she bikes every day. Well, that's a good thing because it would probably be worse if it weren't for that. But those are really important components of it. Fibromyalgia is really tough. It affects a lot of women, And all you can do is to continue to stay moving, continue to stay active, consider hormone therapy, watch your diet and anything that would lead to additional inflammation, because anything you can do to turn down the inflammatory process is going to be very helpful for you. So, are there any other questions that you'd like to ask about hot flashes at this time? I want to remind you, if you have questions, you can go to AskDrMache.com and you can put them in ahead of time. That way, for sure, I will answer them. And even if you miss the session on Thursday, I'll be addressing them, and you can, this will be posted on Facebook, and you'll be able to go back to it. If you are interested in the Hot Flash Rescue Kit, you can take advantage of that offer and get it there for under $20, hotflashrescuekit.com, and check that out. And those are the main things I wanted to say. If there's anything else, I'd be delighted to try and help you or answer with you. I'm here every Thursday night at 9 p.m. Eastern, unless I'm in an airplane at the time of this, which once happened in the time I've been doing this. And thank you so much for the kind comments, and thank you for sharing it. If you do share, let your friends know. And if you have topics that are of interest to you, if you have things you want to talk about, just tell me, and we'll go over those things, because it's important that you get your questions answered, and it's important that you become a partner in your health care. You want enough information to be able to talk with your healthcare provider and be able to advocate for yourself the things that you want, need, and desire, so that those things can be provided to you or help you to acquire them, because menopause is really a transition. It's not about an age, it's just a transition, because it happens at all ages, from the 30s up to the 60s. And because it's not about age, it's about transition. You're just transitioning into the next phase of your life, in which you can live a rich and rewarding and happy and healthy and hormonally balanced life if you get the right information to help you. And I remind you again about my book, the Estrogen Fix. It's been endorsed by the North American Menopause Society, and even for not only for the patients, but for the doctors taking care of them, because it really has a lot of information, including how to talk with your doctor. Because, you know, when you're partially dressed and you go in and you're nervous or you're uncomfortable and you are trying to remember your questions and what to say and what to ask about, sometimes it's pretty hard to pull it together in those kind of vulnerable moments. So I give you some tips on how to be prepared to hear everything that's said, to remember everything that's said, and to ask the things that need to be said so that you get your questions answered. Well, okay, I'm going to say good evening to you for now. I plan to see you, I hope, next week at 9 p.m. Eastern on Ask Dr. Mache on Facebook Live. In the meantime, stay well, and thank you so much for joining this evening. Take care.